average, even a chiropractor, a regular person that has heard of upper cervical or upper neck chiropractic, a medical doctor, a healthcare provider, they've heard of this. They might not want to read the whole thing. What can we explain to them about the paper and just what this is going over in short as a discussion that could really bring some value to them, to explain to them what upper cervical chiropractic is?
Yeah. So I think a great place to start is just that upper cervical chiropractic care has been around since the 1930s. For those in the medical profession, it's kind of a black hole for the medical literature and for the medical healthcare practitioner. There are very few medical doctors who really focus on that area and study it and work just in the craniocervical junction. They usually work either above it or below it. So in the skull, in the brain, or in the neck below. So we talk about orthopedic surgeons, we talk about brain surgeons, neurologists, these sorts of doctors, they work either above or below. So the upper cervical spine is a very unique area. It requires a very specific correction. And so that need was seen very early on in chiropractic. Chiropractic was developed in the United States in 1895. So you'd say, 35 years later, we've got this specialty that comes out where they're trying to understand how best to correct the upper neck to help the brain work better, to help the neck work better, to help the whole body work better. And really the goal back then was to do the least amount of adjusting with the greatest benefit. And so that's where upper cervical really shined, was that they found that they had more impact on other parts of the body if they really corrected C1 well, specifically left it alone and watched and waited and saw what happened. And so there developed this science, this specificity, this art of objectively testing with measures of X-ray analysis, with measures of posture, with measures of thermographic scans, with palpation, with all of these tools that objectively could be seen before and after changes that stayed constant if the correction was done properly, and what is called held the correction in the upper cervical profession, where the misalignment of that upper neck didn't go away. And so if we talk about misalignment, that's a really important piece, is that, the upper cervical spine is very special in that there is no disc above or below C1. That vertebra C1 over C2 gives you 50% of rotation. The skull on C1 gives you 50% of flexion and extension for the spine, for the cervical spine. So when you talk about movement, that area of the spine is the most mobile part of at least the cervical spine, if not the entire spine, and houses the brainstem. And so there was an early need for a specific good correction. Through this paper, we really outline some of the unique pieces of the upper cervical profession.
The patient or the chiropractor, the medical doctor, whoever is listening, to understand, how can I tell if I'm going to an upper cervical chiropractic office? And these techniques are a really good starting point to know that that office is actually doing an upper cervical technique.
Yeah.
Anything to add to that?
I think that it's really important just that we approach the safety part of upper neck corrections. So you covered a lot of stuff there, Kevin, and it brought up a couple of things in my mind I just wanted to hit back, review real fast. So you brought up subluxations or misalignments in the upper neck, and the reason why we do what we do is because the brain is the master control for the body. And the spine is what houses the nervous system that communicates all the messages out from the brain to the body. So if there is a problem with the body, every single organ, tissue, and cell needs to have a direct nerve connection to the brain. we've seen this in many studies over the years, that if the brain is not fully connected, we start to have a loss of function. And so what we found is that over time, the better the correction is, the greater the neurological benefit. Now, it's not saying that upper cervical chiropractic or chiropractic in general is a magic wand or a magic pill. There is no magic wand or magic pill in healthcare. But why upper cervical is important is because for those who are brain injured, for those who have extreme neurological disabilities, the brain stem, which it sits inside of C1 and C2 and that craniocervical junction, it needs special attention. And that's what upper cervical chiropractic does really well. And in that, a subluxation of that upper neck can affect the entire body down to your toes. I mean, I've had patients, I'm sure you have had too, that had pain in their feet or pain in their toes, burning, numbness, and tingling in their toes. But that gets better with upper cervical chiropractic care. Now, I don't have a specific study to tell you exactly that you know, this is case review, this is how that works. But I'm saying subluxations or misalignments of the upper neck can affect the brain stem so severely that it can limit the nerve function through the whole body. And so that's where upper cervical care is really powerful. Does that, I just wanted to add that piece, and
absolutely.
Then go ahead if you.
And you spoke about the anatomy of the upper neck, as far as there's no discs or cushions between the head, the top bone, and the neck. And then a little bit about the neurology with the brainstem being just right there. So that can be affected, you know, when we think about the dentate cord, you know, theory as far as how that can affect. But as you know, with Dr. Scott Roche's research, and there's a lot of research, it's just incredible how many things can be affected by a misalignment in the upper neck. And so regardless, you know, if we take away technique and different protocols and procedures on how to align the upper neck, even if you were doing it in the traditional way that chiropractors do, it still doesn't take away from the fact that it's the most important area of the spine in regards to so many things, like the neurology and the brainstem, like the proprioception, mechanoreception in the joints and the muscles of the upper cervical spine, like the cerebral spinal fluid flow that can be affected by a misalignment in the upper cervical spine, like the secondary venous outflow or the secondary blood flow coming out of the head that can be affected by the misalignment. So it's just incredible how many things can go wrong when you have an injury to the upper neck and a subsequential chiropractic subluxation and problem in that area, and the problems and the plethora of problems that can cause in the spine. And so that just I mean, we didn't come up with these techniques. It just it's a big statement to say that that's why these specific techniques have been developed for the upper neck. It's because it's such an important area, and it needs to be treated as such. It's a study in and of itself.
Yeah, and for 90 years, this has been going, literally 90 years, since 1930, and actually a little bit before that. It started in the 20s. So it's just important for people to know that upper cervical does exist. It is out there. It's also very safe.
Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support.